Hello, I'm Dr. Deborah Wilson. I'm a gynecologist in Scottsdale, Arizona. And I would like to talk to you about the various methods of hysterectomy. For years and years, we had two types of hysterectomy. So let's backtrack a little. Women need hysterectomies when they have large fibroids, they have abnormal bleeding, adenomyosis. There are a number of reasons that women would seek out a hysterectomy. So we can discuss all those reasons at another time. But say you're a patient who decided that you need a hysterectomy. The doctor says you need a hysterectomy. You need to get that uterus out of there because it's bleeding or it's causing pain or whatever. So you have a number of options. For years, we only had two options regarding surgery. Open surgery, big incision, up and down incision, or incision across the lower belly, or a vaginal hysterectomy. But as of about 20 years ago, we came up with other methods of doing hysterectomies. Laparoscopic hysterectomy has become almost the standard, at least in the area that I work in. And laparoscopic hysterectomy has a number of different forms. I do multi-port hysterectomy, and some doctors do what we call single site. So single site hysterectomy is a difficult procedure to learn, and it is quite advanced, but single site means just one little incision is made in the base of the belly button or around the side of the belly button, and the entire hysterectomy is actually conducted through this small incision, and then generally speaking the uterus is brought out through the vagina if it's not too big. So your doctor will either do multi-port laparoscopic hysterectomy, laparoscopic assisted vaginal hysterectomy, but for cosmesis or a better cosmetic effect, so you don't have even small incisions in your abdomen, you might want to talk to your doctor about single-site hysterectomy. Single-site, actually any kind of surgery that you might need, any kind of gynecologic surgery, can be done through this one small incision with very sophisticated, specific instruments. So keep that in mind. Make sure you look into the various options that are available to you before you make a decision. And when you talk to your doctor, of course, you want to make sure that you ask questions. How many have you done? What's your complication rate? Can I talk to another patient who had this done? These are all reasonable questions to ask your gynecologist when you're considering a surgery that is actually major, but because we do it through small incisions, it ends up being an easy recovery, so it kind of feels minor. So single-site hysterectomy, ask your doctor about it. It really is a wonderful option. Thank you.